I am Dr. Karanjan Karnamboil, Director, Institute of Nova Kidney Foundation, Kerala, India. We are part of the International Federation of Kidney Foundations. All over the world, we are doing charitable work. You all know why we have gathered today to celebrate the World Diabetic Day, November 14th, on the birthday of Dr. Banding from Toronto Western Hospital. In fact, I have been there in Toronto Western Hospital in 2001. Dear students and prospective teachers of the school, you all know now diabetes is booming up in India as well as in the world. India is having a largest diabetic population, and among these, children are becoming more and more diabetes due to the obesity and other factors. Diabetes now become major problem in the kidney disease because most of the patient who is coming to the dialysis or renal transplantation, diabetes is the major problem. Around 60 to 70% of these individuals are having diabetes. So how we prevent this diabetes to become or to preserve the kidneys for the future? That is the Kidney Foundation slogan on the Day of Diabetes. And World Diabetic Day, along with the WHO and World Diabetic Community, here we are celebrating in association with the PTA of the Bhavans School, Manvila, Trivandrum, India. Here we are associating with the Novo Nordisk of the insulin company for celebration of this diabetic day. We have few programs, a small celebration and a small kids programs, and followed by the diabetic walk. The World Diabetic Day. Now, what is the main slogan of the World Diabetic Day is to prevent the postprandial diabetic state or hyperglycemic state, to control the diabetes and prevent further damage to all other organs like heart, cardiovascular system, kidneys, and brain. People now coming with various problems of the diabetes like kidney disease, kidney failure, heart failure, and cerebrovascular accidents, and limb problems, which is leading to amputation due to various infections and vascular incapacity or the insufficiency. Dear students, we should know that why people are developing diabetes and why they are developing these complications and why people are not taking regular drugs, because diabetes is a chronic disease condition. It needs lifelong drugs due to the deficiency of insulin rather than not simply due to the presence of hyperglycemia or the raised glucose state in the body. Deficiency of the insulin is the major problem in diabetes, which we need treatment with the insulin. And those patients who are having other problems like metabolic syndrome, they need some other drug supporting. Once the diabetes or the insulin failure or the islet cell failure takes place, we need to treat very early with the insulin. That will prevent the kidney damage by reducing or not developing diabetic proteinuria or what is called diabetic nephropathy. This is how we will prevent kidney problems or allied kidney or preserving the kidneys by preventing not developing the diabetes early. Now we have a big adult population or big pediatric population and adolescent population in India. So that is the pyramid or the pyramidal state of the Indian population. It is having a large community of young population. Now we are afraid, or we are afraid of already having a tsunami of the diabetes, which will damage heart, kidney, and other organs. Now we have the children who is developing diabetes in the early stage that will take away the healthy population, the nation, that will prevent them doing their own work. And these people are being taken into the dialysis room, heart failure room, ICU, etc., resulting in increasing the burden of the disease and the treatment cost of this country. So the need of the hour is to prevent diabetes and preserve the kidneys and other organs of its